Hi, I'm Jennifer Jiang. I'm at the Z Park Boston Innovation Center. Today it's a great honor to have Professor Shada Salamat together sitting with me. Shada works from the MIT Media Lab and also previously she was assistant professor at King Saud University. So it's a great pleasure meeting you, Shada.
Thank you very much, Jennifer. I really appreciate it. Thank you for the invitation, for the kind invitation.
No problem. We are at this special event, the first healthcare blockchain summit. So it's a great honor to have you as a speaker. Can you give us a little bit introduction about your background? Why blockchain is even relevant for you?
Absolutely. Thank you very much. So just talking about myself, I am a a vice president of mHealth Solutions Division at Anmar IT in Saudi Arabia. I am a visiting scholar at MIT at the Media Lab at the Human Dynamics Group, working on blockchain technology in the healthcare space, and I am also an assistant professor at King Saud University. So I'm taking some time off on sabbatical to work on my research at MIT. So that's my background. I hold a PhD degree in healthcare information systems security and a master's in healthcare information security and privacy.
How did you know blockchain? Like, how did you come across with blockchain in the first place?
Absolutely. So I forgot to answer the question about why healthcare in general, so I'll come back to that. Going to MIT gets you exposed to the absolute advanced technologies available, state-of-the-art technologies, and blockchain was one of them, definitely. Before I went to MIT, I had training by IBM to become a mentor at their Saudi hackathon. So that was my first exposure to blockchain in general. And then in MIT, I decided, it's best to work on that because they had different technologies available. But coming from my expertise, and from the as a healthcare information security expert, I tried to use blockchain to maintain trust in the healthcare space.
Can you maybe summarize blockchain in 2 sentences?
Absolutely. I tell people blockchain is the index of any book, and when you think about a database, I think it is more like the chapters within that same book. So for me, blockchain, briefly, is about a bookkeeper of any transaction that happens on a specific asset, whether it's tangible or intangible. So this is a way of you keeping track of an asset and whatever transactions are happening on that specific asset.
That's absolutely correct. And in developers' world, they call it the world's in one computer.
Yes, absolutely. In one computer, but it's still distributed.
Exactly.
And that's the beauty about blockchain. Everything is mostly distributed. People before systems were, legacy systems were designed as silos, and they're definitely distributed. Blockchain, and then there was an era where they're trying to centralize things, but bringing things together in a centralized world brought a lot of problems and raised a lot of security issues, like a single point of failure. If it fails, then you don't have access to anything, and that's problematic, mostly in healthcare. And that brings me back to the question, why healthcare in general? I always believed that there is a lot that can happen and improvement that can happen in healthcare, being one of the very slow sectors adopting technology. And I consider myself a global patient and suffering from, shortage, or let's say a blockage of information flow and limited access to my very own records is very frustrating. That's why I decided to work on the healthcare space to help in that realm and space.
What is the one thing you would most likely want to change in healthcare industry?
I want to own my data, that's it. The thing is, owning it doesn't give me really control. The full control that one requires for patient-centered care. But owning it or being able to access it and making decisions along with the doctor will help a lot in giving me a better quality of life, because I live with the consequences of that decision that the doctor makes. So me being involved in it and coming to an agreement to what exactly is best for me and not what is best to treat the disease, that's definitely something that I would like to have control over. Having access to the information will help me when I move abroad and I move from one country to another. I have records in 3 different continents, and believe me, every single time I ask for my records, they give me 1 page that I cannot read.
What is one thing you feel like blockchain can solve that other technologies cannot?
Okay, yes, that's a very, very good question. Thank you for asking it, because I cannot wait to answer it and give people some idea of what exactly how I see it from my coming from my perspective. So adopting technology is frightening when it comes to dealing with medical data, because without the information being available at the point of treatment, not affording having that information available to that person can harm the patient. So we all agree that it has to be mature movement towards an evolutionary movement towards adopting technology. Just they had to be in baby steps, because risking that data can actually cause more harm than actually having to deliver care without the technology. So that's the fine line where adopting technology, I understand why it is slow, but we need to move it forward in a safe way and make sure that it's safely done for the patient, not to harm them at the end of the day. So the other thing that why blockchain in particular is because I try to address interoperability problem between legacy and discrete systems, meaning if there is a care that has to happen between different healthcare settings and systems, the information has to flow naturally and seamlessly. Now, this issue has been problematic in different healthcare systems, in the Middle East and in Europe, where we have the regulator, the provider and the payer is the same exactly body, or it's the same let's say participant or stakeholder. So it makes things easier for regulation, but maybe in the United States it's a little bit different, because you have different players within that role, the player, the provider and the regulator. So blockchain comes in very handy in because of the distributed nature of it. It comes in to address the very same problem I tried to address 10 years ago. I started investigating 10 years ago, which is the interoperability of discrete systems. Now, systems were designed as disease-centered. The time when they were designed as an information silo or a data silo to collect information about the disease. Now, when we came to the modernization movement towards patient-centered care, the practice has changed, but the systems has not changed, and it's very difficult to discard those systems and replace them with new ones, because at the end of the day, you don't want to harm the patient by not having that information ready at the point of treatment. Because time is ticking. Sometimes there are emergency cases where every split of a second, sometimes a split second can actually harm the patient and or kill the patient. Yes, absolutely. So with the distributed nature of blockchain and the way that it's organized in a timeline, it shows you the flow, it shows you the transactions happening based on the timeline. That is very helpful in healthcare, and that is very much needed, because one of the problems we investigated in cancer treatment in Verinder Cancer Center in the UK is that once the nurse, who is not very highly trained in the technology, and she doesn't have to be, because at the end of the day she treats the patient or she's an advocate, so she needs to the technology needs to adapt to her practice. Once she opens the system, she doesn't find the information that she needs about the patient. It wastes her time.
And be advised
absolutely, she should be advised by that. She needs to make informed decision based on the data that's available, and at the end of the day, she needs to spend most of her time with the patient and not looking for the information about that patient. So one of the problems they encountered is that they cannot find the latest information. Because the way the information is organized, the layers of information that is organized within an electronic medical record is traditionally being based on the department or based on the disease itself. So it doesn't help them understand where's the latest test result that they can use for consulting or talk when they actually get to see the patient during those visits. So timeline is very important. Immutable is also very important, that I think is very unique to blockchain, because in some countries, when the patient is in full control, having full control over the information is not new to patients in some countries, where the provider does not actually hold any information about the patients. They give the information at the treatment point to the patient, and he moves along with it to the next treatment point. That helps with information flow, but there is no infrastructure to hold it. So in those cases, it was a lot of times the patients with HIV, for example, positive results would hide that piece of information when they go to the next doctor. That harms the patient because the decision is not based on the complete information that is available there. And sometimes if they change that content, not only hide it, but change it, that means some decisions will be based on corrupted information, and that can cause harm to the patient more than curing the patient. So the lovely thing about blockchain that it's immutable. Once it's added there, it cannot be changed. So that's really helpful, because if you want the patient to be in control, you need to make sure that they're up to the challenge, and they will be able to be up to the responsibility and not be able to change that data, because the medical doctor will be, or the physician will be recording that information. So you want to make sure that it's accurate information. And accuracy of medical information is concrete to the security of that information. It's one of the 3 pillars of security of information and system.
We talk about blockchain a lot, and people are saying blockchain hold high promises for a lot of things, a lot of changes, but we haven't seen any adoption at scale.
Okay.
So what project have you been doing at MIT Media Lab? Can we give us some update on the sort of progress that it's making?
Absolutely. Okay. So like any other technology, it's premature at the moment, because when we see some proposals and some pilots that have been rolled out, still they're not scalable enough to be able to make the decision whether it is adoptable or not, whether there are some faults, there are some problems in the adoption or in the implementation of it. So it is still premature, but there is a lot going on in the healthcare. When you compare, for example, in e-government services, when they adopt blockchain, e-government is one of the sectors that are less mature than the healthcare. There is a lot going on in the use of blockchain in medicine and in healthcare in general, when it comes especially to the electronic medical record, because of the problems that we've been suffering from but still there are no mature projects and pilot studies that we and projects that we can see and learn from. So you cannot really learn the lessons from those projects, but it's going to come in the near future. One of the things that we're studying is, or the projects that we're working on in the healthcare space using blockchain, is how to help empower the patient in order to have a patient-centered record that is based on legacy systems. So we're still relying on the existing systems, the discrete systems, and we're connecting them using blockchain in order to increase the interoperability and allow for the information to flow seamlessly between the different health treatment points, regardless of where the health settings is actually geographically located. So this is one of the projects we're working on, and we care so much about using existing systems, because it's more practical to make sure that no immigration or migration between systems happens or upgrade. All you have to do is to add this skeleton where it actually tracks the movement of the patient, so everyone who's caring for that patient can get to know what's happening. And what we're winning here is actually painting the full picture to have a holistic care that is integrated, meaning if the patient has comorbidity and is suffering from more than one chronic disease, then we can get to see them all, and we can avoid making decisions as healthcare professionals from making a decision that can interact with another disease. So that's very important in our projects. That's called Healthy Blockchain at MIT.
Healthy project.
Healthy blockchain. That's a project we're working on, in that interoperability for the individual level, to make sure that we don't harm the patient by not allowing the information to flow. The other project is a bigger scale, which is a population-wide information. This is when we use artificial intelligence in order to build smarter systems for decision makers in healthcare, like could be ministries, regulators, could be healthcare providers, but it's about a population level. We use artificial intelligence but the blockchain element or component comes in handy in auditing what exactly what information is being accessed by who. So you can actually manage, you can actually track back, you can monitor the progress depending on so if you're looking, for example, one of the Opal for Health, one of the projects that we're working on is using the Saudi Ministry of Health MI and stroke cases, where the patients see the symptom in a district, and then they move to they go to a center for treatment. So those mobility, the timestamp and the location stamp of those patients and cases is very important to understand where to build those hospitals. That's a decision that's to optimize the system in Saudi Arabia. So the decision maker here is actually the Ministry of Health, who is actually managing those centers. And we allow artificial intelligence for the visualization part to allow them to get to see the districts and, on the city shapefile. But the blockchain gets to record who is asking those questions on the hospitals, and you can get to see the improvement happening in terms of the mobility of those cases after implementing any plan to optimize the system. And you get to see the differences there without having to change the history, and you get everyone to access that information.
Particularly, I think, Shada, you're bringing like a wealth of experience from the global perspective. Saudi Arabia, India, the cases you just talk about, and the British, the pilot projects, and here at the US, and even at the center of MIT. Among all these, the global events you are seeing, what is sort of the most misunderstanding about blockchain you have seen?
Well, people think it's a database. But it's going to be a lousy database if it does so, because it's not about putting as much information, because it cannot hold much, and the more you put, the more mining it's going to take to and the consensus to be checked and verified, and the block unit to be added. So that takes a lot of time. The idea here is that you don't use it to replace the database. You use it along with an off-chain database. So for me, I think of blockchain as a brooch or a ribbon that can be added to a dress or an outfit in order to make it prettier. And it doesn't function alone, it doesn't stand alone as a technology. You need to build an infrastructure around it, and you add it to that infrastructure to achieve the specific goal that you want. You could build a database infrastructure that is off-chain, and you record the data over there that is on distributed systems. Like what we do, we still keep the data in the legacy systems databases, and we get to record and track the movement of the patient in each treatment point. Recording where the treatment has been, who treated that patient, what information has been recorded. So we don't record the information, but a description of what happened in there. If it's a surgery, then there is a note and about the surgery that happened by a surgeon, and so forth. So we give a description of it, but we don't give the data, and you get to know, you track back the originality of that information, and you know where to find it if you need it. But you get to paint the full picture using that skeleton, and it's not it's not the only solution. It's on top of a solution to help address specific problems in that solution.
Right, so blockchain in a nutshell sort of represents an entire new way of architectural design of the ecosystem rather than just one database technology.
Absolutely, absolutely.
May I ask you one last question that may go a little bit personal?
Absolutely, go ahead.
So we talk about blockchain a lot with friends, families, colleagues, and like, who is the person that you would most desire to have this conversation about blockchain, live or dead, like about how excited blockchain can be?
I was inspired by my grandmother. She passed away 3 years ago because she had stroke, and she was taken to the wrong hospital by an emergency medical services. So that was an inspiring. That's why I'm fascinated about artificial intelligence and advanced technology in the blockchain to help address those problems. She did not get the time to be treated in time, so that's because a lot of time was wasted in delivering her to or taking her to the right hospital. The emergency medical services people took her to the nearest hospital to her home, but it was ill-equipped. And families struggled to take her to another equipped hospital because the regulations there were against that. So coming from that perspective, I wanted to tell my grandmother about it because I'm sure she would have loved it so much. She told me once that she wanted doctors to care about, I asked her once about, when I started my PhD, I asked her, what is the most important problem in healthcare? And she looked at me and said, the problems that I would like my doctors to care about me as much as they care about the disease. So coming from that perspective, I didn't get to tell her the story that I built around, blockchain and how I can manage to help her and the clinicians to care more about her and not the disease. So she's the person who inspired me, and I wanted to do something to help her, but you know, she's not there anymore.
I'm so sorry to hear, but
Absolutely.
I mean, she so deeply inspired you. I'm sure she's going to be very happy to see you are
Thank you
making
very
such
much.
tremendous progress. I mean, in the end, this is technology, but technology works for people, and you know, it's our duty and mission to make sure we make the most out of what we can out of the latest technology.
Absolutely.
And blockchain, as we all, as enthusiastic as Pathfinder we can be, hopefully we can accomplish that mission.
Definitely, and make a huge difference, even little in baby steps, but at least at the end of the day we will get a better, give a better quality of life to ourselves as patients, and to build a better tomorrow for everyone.
A better future with the blockchain.
Absolutely. Thank you very much.
Thank you so much, Shada. So together we are at the first Healthcare Blockchain Summit at Cambridge. Thank you so much for watching.